Good afternoon. I'm Gisela Chelimsky. I'm a professor of pediatrics at VCU. I'm a gastroenterologist and an autonomic specialist, and I direct with Tom the Autonomic Center that sees pediatric and adult patients.
And my name is Tom Chelimsky. I'm a neurologist at VCU. I'm director of the Comprehensive Autonomic Center with my wife, Gisela. We've seen patients for many years, perhaps about 20 years together, and have set up this program together.
What we would like to discuss today is the role of the fight and flight response when you have chronic pain. So, Tom, do you want to share a little bit about the fight and flight response?
Sure. Well, it's one of my favorite topics as a neurologist. So our brain has many, many complex components. And the one that we're talking about today is the one that either sets us up for growth, development, restoration of energy, or can set us up for fight or flight in a situation in which you're being attacked. The attack can be virtually anything. It could be an attack of COVID. It could be that you were traumatized by a picture of a war picture, for example. Somebody could have died recently, or you could have actually been attacked. Any of those. And then your brain, there's a particular area of the brain that senses this information and puts you into a mode in which you are ready for fight or flight. And that is not in your direct control. It is in your indirect control. We'll talk about that later. And it is a set of consequences. Your heart rate beats faster, your blood pressure goes up, you may need to pee, all kinds of things that we refer as autonomic things happen. Now, there's another system, which I should mention, called the rest and digest system, which is active if the fight or flight system is not active. So the rest and digest system, sometimes known as the vagus, is the system that causes you to feel at peace, good, you want to learn things, you want to develop, you want to grow. And during that time, there's a lot of energy restoration happening. When the fight or flight system is active, then what you're doing is you're stealing resources, you're taking resources from the body in order to establish the fight or flight. And in the end, you want to survive. So you're going to take whatever energy it takes to do that.
So patients with chronic pain, it has been well studied that you normally have a balance between your vagus or your homeostasis and your fight and flight response. You need both to survive. When you are attacked in the street, even when you get up, you need your sympathetic, your fight and flight to respond so your blood pressure doesn't drop. We need the fight and flight response like now when I'm giving a talk to you, just so I can do this, But the problem is when that fight and flight takes over your life. And there is a lot of research done in chronic pain where there is decreased vagal response and increased fight and flight response. So how do we work with that? And how does that apply to you that has chronic pain?
And maybe I'll just add something right there to say that the fight or flight system, when it's active, and the pain system are not two separate things in the brain. They're really the same thing. And the pain system is basically a way for the brain to tell you, the person, that you're in fight or flight mode. The pain system is an alarm that goes off to notify you that something is wrong. So chronic pain and fight or flight are often working together in the exact same system. So sometimes managing the fight or flight helps to manage the pain. And I think that's where Gisela is going with this.
Right. When we are trying to treat patients that come to us with chronic pain, we try to see if we can identify when did that trauma happen. And it's interesting that often patients don't even remember that they had a trauma. Many times we don't hear it in the first visit, even when we ask many times. Sometimes it comes up many visits later, because often we tend to suppress those very negative experiences. What we are seeing a lot since 2020 is that after having COVID, people have this long COVID that probably belongs to this group of disorders. But you can get this problem also after any infection, after a car accident. We see it a lot after concussions. It could be stress. So those are easier to identify. Is the traumas that you may have had at an early age, maybe physical, emotional, or sexual abuse that our body, that our brain will suppress.
Let me ask you a question. So in your clinic, you're a gastroenterologist. People may wonder, well, why would a gastroenterologist get involved with this? And I think there's very good answers. And then after you answer that question, then how would you manage, or what would you try to address in someone who comes to your clinic with, say, abdominal pain, where you may have identified a trauma? And what would you advise them, and where would you go with that?
So what Tom is going to is that many times patients have functional gastrointestinal disorders. Those are gastrointestinal disorders where it doesn't matter which study we do, if we do a scope, if we do a CT, if we do an MRI, if we do blood work, everything comes back normal. And that doesn't mean that the pain is not real. The pain is 100% real. And I always tell the patients, it's not your problem, it's that science has not evolved yet for us to have a diagnostic tool to diagnose this in a positive way rather than by symptoms. We understand in 2023 that these are disorders of the brain, not psychological. A lot of patients with chronic pain were sent to the psychologist because you don't have anything, right? But we think that this pain gets originated in some way in the brain, and I will let Tom say more in a few minutes. So patients that have dysfunctional gastrointestinal disorders like irritable bowel syndrome, chronic nausea, chronic abdominal pain, usually have other symptoms associated. And now the National Institute of Health calls these disorders chronic overlapping pain conditions, or COPCs. And then we see that often these patients have headaches, have fibromyalgia, have chronic fatigue, have sleep disorder, has dizziness and lightheadedness. Some are double jointed, they have EDS.
Or POTS.
Or POTS. So before I go into how we treat them, do you want to explain a little bit about the role of the brain here?
Sure. I think you kind of led right into it. Normally, your brain fight or flight system should just be active during the time of the trauma. So if you're sick for 2 weeks in the hospital, it should be active for 2 weeks. If you've got COVID for 3 weeks, it should be active for 3 weeks. If, God forbid, you had a sexual assault, it should be active during that time and the recovery time for 10 days or so. But the human brain is not as good as the brain of the impala or the zebra that's got, after the attack by the lion, boom, it recovers and goes on. We get stuck. Our brains get stuck. And when the brain gets stuck in this fight or flight mode, what happens is that we start exhausting those resources, energy resources, brain resources. And we start attending to the body as though everything is an emergency and everything is an alarm, which is absolutely exhausting. So the chief issue patients have often is fatigue. But on top of that, we start developing pain syndromes, such as the bowel syndromes, migraines, and other things. And it's very hard for the brain to actually stop the fight or flight system. What we need to do is to, in the brain, activate the vagus or rest and digest system, which will counterbalance the fight or flight system. In other words, convince the brain that it is in a safe environment and that it's okay to start growing again.
So to finalize, what can we do to help patients that have these disorders? We work in what we call a biobehavioral model. We doctors cannot do it alone. We need a group of providers, of medical providers, and the patient is probably the most important component in this treatment group. We need a psychologist or some behavioral therapist that can help reframe the way the brain is interpreting the signals. Because we are in this fight and flight mode, the brain is interpreting every signal as a threat. This is dangerous. I need to react to this. So we need to work with the psychologist, or the psychologist needs to work with the patient to learn new techniques, how to reframe those signals.
Dangerous until proven otherwise.
Yep. We need to work with the physical therapist. Many of these patients have fear of moving. Moving produces pain. Moving can be dangerous because it produces pain. So then they start sitting down a lot, be in bed, then they get deconditioned, then they get more lightheadedness. So we talk about the need of physical activation. And what we do as physicians is help with medications that are going to be adjuvants. They're not the primary issue. The medications only are prescribed to help you go and do your physical therapy, help you if you are very depressed to say, okay, I'm going to try to move, because when you're very depressed, it's hard to initiate. So they're only adjuvants to get you to do this biobehavioral therapy.
No medication is going to turn off the fight or flight system magically. That's something that you do. But we can help by, as Gisela just said, adding things that make it less difficult to start that journey. What about, what can people do on their own? Let's say you have, we sadly have a 1 year waiting list to see people. And let's say you have POTS and you have fibromyalgia in the wake of long COVID. I'm just pulling that out as an example. What could you do on your own to help yourself if you can't get in to see a doctor who knows about this stuff?
So thank you, Tom, for that question. There are things you can do. Ask your primary care to give you a prescription for a physical therapist. Start going to the gym. Start slow. Don't try to do half an hour. Maybe go to the pool and do some walking in the pool. Take a yoga class. Yoga is very good for you because you incorporate something called paced breathing that we do in yoga, slow in and out, plus increasing your muscle tone, your flexibility. And you can also reach out to the Massey Integrative Health Center. And at the end, you will find some numbers that may help you, that can give you resources how to work with chronic pain.
And all these things, yoga, exercise, and so on, all of these activate the rest of the digest system. So you are working against this kind of silent killer called the fight or flight system that has stayed stuck in the on position.
Thank you so much for listening. Have a wonderful day.